Hi, guys, and welcome to the Basic Latina podcast, an intimate conversation with friends about love, life, and wellness. For today's episode, I have two of my good friends with me, and we're going to be talking about healthcare. So, first, I have Jakell Burgess. She's a family nurse practitioner, and I have Sarah Chambers, and she's a community pharmacy manager. Ladies, you want to say hi?
Hello.
Hello.
Thank you so much for being on here. So, I'm so excited to dive into this because when I started the podcast, I wanted to make sure that we addressed wellness. And there are a lot of things that particularly affect people of color. And so I have two beautiful women of color with me, and we're going to kind of talk about some of the pressing issues that are going on with our healthcare today. So, ladies, do you each want to go into a little bit about yourself and kind of how or why are you doing what you're doing right now?
Sure, I can definitely start. So, hi guys, my name is Sarah Chambers, as Amirs just gave me that wonderful introduction. So I am currently a pharmacy manager at a local pharmacy in Massachusetts. And I got into pharmacy because I started off as a pharmacy technician. I realized that I really loved chemistry in high school, but I couldn't really figure out where I wanted to go from there. And I started getting really anxious because I know a lot of my friends, they started talking about what they're going to be doing in college and where they're going with their future, and I had no clue. So as I started to talk to family, and I have a lot of family in the healthcare field, a lot of them pointed me towards pharmacy, and I brushed it off for a while. But then I actually had the opportunity to speak with one of my local pharmacists, and I kind of realized just how accessible pharmacists are, and I just thought that was so cool, and I thought that I would really be able to have a big impact on a lot of people. So I started becoming I became a pharmacy technician, and I realized, this is actually where I want to be. So I went to the University of Connecticut School of Pharmacy, and here I am today.
That's awesome. And then you still practice in Connecticut, and you work in Connecticut.
I practice in Connecticut currently, and I have just started a new role as a pharmacy manager in Holyoke, Massachusetts.
Nice. Great. What about you, Jakell? What brings you to the healthcare field right now?
So my role as APRN, it's a little unique. So I don't know if most people are familiar with the role of an APRN, but what it is, it's a master's prepared or doctoral prepared registered nurse who has the scope of a provider to assess, to evaluate and treat, and even do small procedures. So I started out as an RN. I've been an RN for almost about 5.5 years with my background in ortho trauma. I did some ICU. I did some daycare, checking the immunizations. Yeah. And currently I'm a family nurse practitioner, so I provide care for newborns to elderly, and I work at a family health center in Connecticut, specifically within the urban community. That's our patient population now, so.
That's amazing. And as you were talking to Cal, I was thinking about a conversation I had with my coworker yesterday about how as women of color, as we are going higher up on the tier in like really big roles, that you see less and less of us. So when you guys were growing up, or when you were in college and you started deciding like, I want to be a nurse, I want to be a pharmacist, do you see any women of color that you were like, wow, she can do it, I can do it? Did you ever feel like that at all, like you had that experience?
I personally haven't, and it's funny because when you step into a classroom, you automatically count the black people in there.
Oh, yes.
Just to know that you're not alone. Yes, even going into my master's program, I'm like, all right, there's 3 black girls. I know we can make it.
Right.
Yeah.
But I never had
an RN,
a specific, role model. There's no healthcare providers in my family, but I just always knew I had a personality to care for people. And I remember going to like the clinic in the Bronx, and it was like so packed, and it was like one doctor, and everybody knew who that doctor was. And I'm sitting there, I'm like, this is terrible.
Yeah.
So I'm like, I think I want to go into the healthcare. So I always knew that I was going to be a nurse practitioner. It was just a matter of when.
And it didn't deter you that you didn't see anyone that looked like you in that role?
No.
Okay.
No.
That's good.
But looking back, I know how important it is for me because when I was doing clinical in school, I was at a school in Bridgeport, Connecticut, working with the fabulous APRN who was Caucasian. And she noticed that all the kids would gravitate towards me and they would feel comfortable talking to me. And she would always say, "You're a black girl in a white coat. You don't know how huge that is."
Yes.
So hearing those words to her was just so empowering about how important my role is in the community regardless. So
Yeah. What about you, Sarah?
So my experience is kind of similar to Jakell's. I didn't really ever have any black female pharmacists that I could see as role models. They just weren't around. I remember specifically when I was getting ready to apply to pharmacy school. I was working in a pharmacy as a technician, and my pharmacist, my boss at the time, I would talk to him about how nervous I am applying and just all the things that I was getting anxious about. And he was an older white gentleman, and he looked at me and said to me, "Oh, you have nothing to worry about." And he went like this. And for you guys who can't see what I'm motioning, but he pointed to his skin to kind of infer, he pointed to his arm, so to infer, you don't have anything to worry about, you're black, so affirmative action will take care of you and you'll be right in there.
Sickening.
So, I feel like things like that only motivated me more to have to prove myself, like, okay, I'm not good for a black girl, I'm just good, period. So, yeah.
It's awful.
I'm sorry that happened to you, Sarah.
Yeah.
That's it. That brings me to a story that Jakell once told me. So Jakell and I went to school together. So when she talks about, counting the amount of black people in a classroom, we went to predominantly white all-women's college. And so it was like that. Our group was diverse, but even just taking your general education courses, it was mostly white women and stuff. And Jakell would come home with some horror stories when she was just starting out, like as a nurse, about people not wanting to see her. So you want to share one of those stories?
Yeah, I remember when I first started as an RN, I had a patient. When I walked in, she automatically said, "Absolutely not. You will not take care of me." And it was pretty obvious in what sense she was talking about, but I wanted to be professional. And I'm like, "What's the matter? Can I help you with anything?" And she's like, "You're black." Ooh. And, I was almost stunned, and I've always been very poised, and I just don't lash out. So when she said that, it almost took my breath away. But it was like, I'm like, we're at that point, it was like, 2014?
Yeah.
So I was like, holy moly.
Oh, my God.
But, I said, unfortunately, I'm your nurse today, and we'll get through the day. Because
she didn't. You guys didn't switch.
Absolutely not. If she has,
good for you.
There's no way that she should be able to choose who takes care of her. No, it's either me or nothing.
Because don't you guys get taught in the medical field, if it's a rapist, if it's like someone who kills someone, you still have to treat them the same way?
Oh yeah, absolutely. Everybody gets taken care of the same way. So it
should be the other way around.
And I spoke to my manager, who spoke to her and said, "This is your nurse for today. If you feel like you want to be treated elsewhere, you can sign out AMA." So her options was either to leave against the medical advice, or to stick with this black nurse for 12 hours.
Dang. So how did that day go?
It went just fine.
Good.
I gave her her medication. She responded to my questions. I checked on her every hour, as I did all my patients. She never apologized. I never expected her to, but it was what it was.
On top of the fact that you guys are both black women in your field, we both, you guys can't tell, but Jakell and Sarah both look really young, like I do too. And on a good day, our hair in a bun and no makeup, we in college still, So, can you guys each share maybe a story of someone not taking you seriously because you're so young? Because even though to me you're both really established in your careers, you're still early career professionals. So you're probably loving what you're doing now, but you're starting out, so you have to deal with the adversity of being a woman of color, but then being a young woman of color. So do you guys have experienced that before?
Gabbie, cut that out.
Yeah, Gabbie, cut that out, boo. That's funny.
Yeah, I'll start. So I actually had a patient recently who has an extensive history that I just started taking care of as an APRN, and he's a difficult patient, and he felt some type of way because I wouldn't prescribe him opioids, and as many of us know, the epidemic these days is insane, and the federal laws in place just allows you to practice in a more frugal way. So he literally told me, he goes, I know you're young and you're new to this, and if you feel like you can't take care of me, let me know now and I will find another provider. And a part of me wanted to just be like, please don't threaten me with the excitement of you leaving. But, as professional as I am, I told him, I said, it is your right as a patient to find another provider, but all the providers in this office practice with the intent for safety of all our patients, and we advocate, but if you feel the need to find another provider, you can do that. But I felt like he was not only taking the color of my skin, but my age, just to kind of attack me, because he also brought up another provider in the office who is my collaborating physician, who is amazing, and she's a Black woman as well. And he kind of brought her up and almost was like, well, she made me feel a certain type of way. And I told him, I said, I think the feelings you have is slightly personal. We should probably talk through them. So I try to bring them full circle to respond therapeutically, but you get attacked in this field, especially as a young Black woman. It's you always have your guard up.
You have to work twice as hard, I'm sure.
All the time.
Definitely. I don't think I have a specific situation where I've felt that way, but it definitely happens to me all the time where I'm working with, let's say one of my technicians who happens to be a white male, either an older white male or a younger white male, and people will come to the counter and I will go up, although I am the one in the white coat, I will go up to speak to them, introduce myself, and they'll say, oh, I'd like to speak with the pharmacist, and I'll respond, oh, I'm the pharmacist, how can I help you today? And they're like, oh, you're the pharmacist? Or I'll get, really? You? Oh, okay. So, I mean, it's just subtle things like that where I know they're not expecting little Black me to be the pharmacist.
You're so small, Sarah.
And I had this one guy in particular, he just kept apologizing and apologizing after. So, I mean, I don't know.
No, that's ridiculous. I'm sorry that you guys have to deal with that, because it seems like it doesn't matter what women of color do to work hard to get to a certain place. We're still brought down to a place like you don't belong here. Like, you don't deserve a seat at the table, which I think is ridiculous.
Yeah.
So there are a lot of, when I go to the doctor and things like that, I always think about how there are particular issues that affect women of color. Like, they're always labeling. I never know if it's labeling or not. So I want to talk about that a little bit, because you guys would know whether or not it's sort of labeling. So they'll say obesity rates are up for people of color, and heart disease is up for people of color, and cancer is up for people of color. So I'm just like, is that true? Because I know that there's certain, correct me if I'm wrong, are there certain, I learned in high school that sickle cell was something that affected Black people particularly, right? Is that so correct?
Correct, yes.
Right, but then stuff is it fair to say that we are the population the most that's being affected with heart disease and obesity and stuff like that? Because I feel like that's a thing that's affecting everyone, and obesity has no color. I guess what I'm trying to say is that is that a health concern that you guys are seeing in your clinics? The heart disease, the cancers, the obesity, those things that are related to us maybe eating and our health and stuff like that.
There's definitely barriers to healthcare, and I think that's when our community, the Blacks and Hispanics community come into play, because access to healthcare, and then there's a lack of trust in healthcare from our community that plagues us with these certain conditions. For example, immigration status.
Oh yes.
That's huge.
So are people not seeing their primary care, following up with them because of them maybe not having their immigration status and not being able to pay for things?
Yeah, so I have a lot of people on my schedule, and I'll follow up, why didn't they come in? And they'll say, oh, their insurance hasn't kicked in, or, you know, their immigration status is questionable right now. So I think that's the number one barrier. And then we'll get into cultural aspects as far as like how we treat our bodies, what we eat.
Right.
And then there's also the poverty issue.
That's true. So it's like you have the first appointment because in your role, Jakell, you're a primary care physician, right?
Correct. Primary care provider.
Provider.
Yes.
My bad.
No, that's okay.
So first is the barrier is getting them into the door, right? If they don't have a status, and then when they're sitting down with you, it's all these slew of issues with poverty, not being able to maybe have those conversations. Like you're having a conversation about dieting and eating, but they're like, well, I can't walk outside because of this issue, or maybe I don't have the money to buy fresh vegetables and stuff like that.
Right. And then there's also then there's social discrimination. So when people feel like their provider's not listening to them or they don't connect with them, they won't go back and follow up with their diabetes or their heart conditions. And this poor follow-up just leads to, you know.
And you work in a heavily populated urban area. So do they always push the people of color on you? No.
It's funny you say that because I was thinking about it today and I'm like, to be honest, I can probably count on my hand how many white individuals I've taken care of. That's how heavily populated.
Because you don't make your own appointments, right? They make them for you.
They make them for us, and I'm actually in a teaching facility, so we have residents from Yale and residents from, you know, another hospital at my health center. But it's heavily Black and Hispanics. So they'll be seeing whoever is put on their schedule. But I have a lot of patients be like, I want to see you. Because I feel like they connect with me on a certain level. They feel like they can trust me. They feel like they can talk to me about certain issues. Especially your young population when it comes to STDs and, you know, education about, you know, violence. And I had a mom come in the other day and she was just talking about, you know, her father's child and postpartum depression and...
My God.
She was opening up and you can just tell like she was exhausted and she kind of came in with her guard up initially, but when I sit down, eye level is always best for me. I never, because you're taught to go on your computer. You see a lot of the residents on their computer. I'll put the computer.
The mobile cart thing?
Yeah, that's going in the hospital. We actually have laptops.
Oh, nice.
Yeah. But I'll put the computer to the side and say, talk to me, what's going on.
Right.
Because I feel like they need that. They need you to kind of, you know, get on their level and not, you know. And I don't wear my white coat in the office.
You don't?
Nope.
Oh, wow.
I don't, because I just feel like it just adds an additional barrier. I don't want people to feel like they can't trust me because I'm at a certain level, you know.
No, I love that you said that because it's funny, and I didn't forget about you, Sarah, I promise.
Oh, no, it's fine.
No, I'm sorry, Sarah.
No, you're fine. But I work in a medical profession right now. I'm not a physician or anything. I'm not in the medical field, but I work at a children's hospital, and we have a research meeting, and we were talking about doing research in the community about intimate partner violence, screening women in our clinic when they come in the trauma unit, right? To figure out how many women who are coming in are being affected by violence. So we're trying to figure out who should be the one giving the women the tablet. So we're going back and forth. Should it be like a research assistant? Should it be a physician assistant? Should it be a social worker? And so we were going back and forth, and I cannot believe that someone in my job was like, well, why don't the doctor do it? And then so we were talking about the barriers to having a white coat, and there's 2 people of color in my office. And the 2 people of color, of course, are the people saying, like, the person with the white coat shouldn't be the one given the tablet, because that might not be the person that the patient at the time might feel comfortable talking to, because usually it's the nurse that they talk to the most, or the PA, or whoever comes in. And then the other people who are white were like, I don't understand why people of color have such an issue with a white coat. And I was like, oh, we're in a hospital in an urban setting. How do you not understand that?
Yeah.
And I think like the white coat is like a badge of honor, right? Because you wear your white coat in your job.
I do.
Right, and you have a white coat, and I remember everyone was so excited when you got your white coat.
I know.
But it's just like now you don't even wear it because you're like, I know, like, for me it might be a badge of honor, but for them it might be, like you said, a barrier.
It is definitely a barrier. And, you know, there's provider bias. So there's a lot of articles are circulating about like how specifically Black women or Black individuals or Hispanics are treated versus white individuals. So there was, and please do your own research, but there was an article that came out and it was saying when it came to pain management in an ER, a white patient was more likely to get pain medication quicker than a Black or Hispanic because they're judged for kind of just like seeking. And you do see that often. It's almost kind of like they're automatically judged. And it's unfortunate because, you know.
I can't believe a hospital can still do that.
And you see the same kind of thing when you look at research with when people come over to a prescriber or to a provider, and if you have a white woman complaining about one symptom and you have a Black woman complaining about the same exact symptoms using the same verbiage, you're going to have the Black woman, they're going to kind of stereotype her and kind of not take her as seriously as the white woman and kind of just box her and kind of, yeah.
Oh my God. And it still throws me that people can do that because I'm seeing, even though I'm seeing more people of color in the medical field, I'm still seeing a lot of people of color who are going to doctors saying that they're complaining of these things, but they're not being treated the same. And then the women or men of color who are in those medical professions are overworked perhaps, right? Because maybe you have all the people of color and you have too many people on your like load. And then what do we need more people of color to be in the medical field, perhaps?
I think we always need more people of color
Yeah.
in all fields.
I said that and I was like, that's dumb.
No, that definitely wasn't dumb. I see where you were going with that. I think it would help bridge a gap when it comes to, you know, healthcare and the needs in our community specifically. Right. Just because we surpass in things like heart disease, diabetes, and I think there's just a lack of education in the community.
Are people talking about, and hopefully you guys can both speak to this because this is something interesting. So I'm working with the nurse residency program at my job, and we're talking to them and stuff about inter-partner violence. That's what most of my role is focused on. And we asked them, do you guys know what trauma-informed care is? And it was crickets. And I was like, did I know what trauma-informed care was when I started out? So it was just one of those things like, how do you work in the health field and not know what trauma-informed care is? Am I being too hard on them? Like,
I think most programs, specifically RN programs, it's just you're saturated with so much information that things like, you know, interpersonal violence kind of gets, you know, brushed over quickly.
That's true.
Which is unfortunate because it's pretty relevant and you see it a lot. So I think the amount of information, and I'm sure Sarah can attest to this in her program as well, you're just saturated with having to know everything that, you know, subjects like that unfortunately get watered down.
And you often have to wear multiple roles, right? So you have to sometimes you're the provider, you're talking to them on the phone, maybe you have to translate. Maybe you have to talk to the family members about something. Maybe they're hysterically crying and you have to talk to them about something else that's going on in their home that has nothing to do with the medical profession or something. So
translation's huge. Do you have a translator at work?
So we have a system that we can dial
like a
into.
phone?
Yeah.
Oh, no.
So do we.
I said, oh no, because I've used it before and it's so bad.
It's so bad.
I know.
It's just not ideal.
It's not. At your setting, is it pretty urban, or would you say that it's mixed?
So the setting that I'm going to be in now is not going to at all be an urban setting. But I will say that
I don't know why I thought Holyoke was mixed.
One side of it's pretty. It has a huge Hispanic population, but like she said, it's
pretty white.
From what I've seen, yes. So I haven't fully entered the role. I've only been to the store a few times so far. But from what I've seen, no, it's predominantly white. But I will say that what's kind of cool is before I moved into this role, what I've been doing most recently is I've floated around to different pharmacies all over the state. So I've got to see what things are like in like the Torrington, Litchfield area versus the Newington area versus the Stamford area, and things are just, it's night and day. They're completely different.
Wow.
So.
What's the biggest difference that you see between the rural Rural?
I
can't say that word.
Rural.
Between that and the urban towns, because I'm sure that there's many, but what's the one that's like, dang, like this is the most obvious one?
I would say between rural and urban specifically, I would say, it depends. There's quite a few differences. So if I were to talk about, and I'm sorry if I'm not answering your question.
No, I'm trying to think. I'm like, was rural the right?
So between suburban and urban.
That's what I meant. I'm like, I said rural, and I'm just like,
it's all right.
Edit that out. So between suburban and urban, what's the difference that you're seeing since you were able to travel all over the state?
So between suburban and urban, one of the biggest differences I would say is patient education. Yeah, definitely.
That's huge.
So in the suburban areas, I feel like, you have a lot of middle-aged white women coming in to pick up for themselves, their families, and they are very well informed. They have either been reading articles, they have been watching Dr. Oz, they have good old Dr. Oz. They know
what they're taking.
They know what they're taking. They know what questions to ask. They know even probably more than I would like them to know. No, I'm kidding. But I would say in the urban areas, I think one of the things that is a little bit tougher for me is you go in with those leading questions. So what questions do you have about your medications? They're not going to have too many questions, unfortunately, a lot of the time, because a lot of the times they don't even know what to ask, or they're too embarrassed to ask questions, which I think that's where it comes into play, building those good bonds and good relationships with your patients, because I've gotten to the point with a lot of people who, like Jakell was saying about one of your patients earlier, who really had their guard up when they first came in. I've had that experience a lot in the urban pharmacies, where you have people that come in with their guard up, but you start discussing, maybe things that are more what they find more relevant, and kind of lead into the talks about their healthcare and things like that. So it doesn't always happen in a day. It usually doesn't happen in a day, but building those relationships is just so important, and kind of helping them and really being an advocate for them, and kind of, I don't want to say educating them, but I mean, you do play an educational role. Yeah. So.
That's interesting that you said that you build a relationship with the people who come in, because I pick up medication for both me and my mom for years at the same CVS. And I don't know if they just have a really bad turnaround rate, but I feel like the pharmacist is always changing. And I never had a relationship with the person that's behind the counter. They're really cold. And this is in the West Hartford line. They're really cold. They ask me oh, do you have any questions about them? They're literally like, do you have any questions for the pharmacist? And I'm like, no, not with that fucking attitude. It's one of those things where I was watching Stranger Things.
Yeah.
And one of the Stranger Things? I think it's Stranger Things. One of the characters in Stranger Things has a family pharmacy where the pharmacist knows anyone, and he's like, oh, hey, Carol, I still have your hemorrhoid cream. It's in the bag. They have a conversation. Yeah. The CVS that I go to is bananas. I think if somebody yelled to me bananas, I got your hemorrhoid cream, I'd be embarrassed. It's
well, it's also a violation too.
Yeah, of course, but
I feel in larger cities like that, they're so overwhelmed, and the backup of supplies, and we're just from a provider standpoint and working with pharmacies constantly, it's almost kind of the patient just had this prescribed by another provider, so there's also these holes in communication when it comes to healthcare amongst interdisciplinary teams.
So you guys might not communicate.
No, yeah,
Or you try
specifically.
to, but-
So, like, if I have a patient who also has a endocrinologist, doing their diabetic medications and a cardiologist doing their cardiac medications, but they come to me and say, I need a refill.
Right.
But then cardiologist might have put one through and the pharmacist is like, no, like they already picked it up. So there's always this kind of it's a lot.
lack of communication between
so,
the teams.
Yeah.
And, I would say if for someone in your situation, if you're feeling like you are not getting if you feel like you need more attention and more care than you're getting at your pharmacy, I would definitely
see you.
You should just come on down and see
That's
me.
right.
So I have the benefit of working in a relatively slow pharmacy. So we do a few hundred prescriptions a week versus
a few hundred a day.
No, a few hundred a week. I said a week versus a CVS or a Walgreens that you're talking about that may be doing hundreds and hundreds a day, thousands a week.
That's a lot.
So I can totally get.
Yeah. So if you're feeling like you do need more attention like that, I would suggest possibly seeing like an independent pharmacy or maybe even a pharmacy that you wouldn't necessarily think of as off the top of your head, like maybe one in a grocery store, a location like that, because those are going to be the ones that definitely have a much lower script load, and you're definitely going to get a lot more one-on-one attention if you feel like you need that.
It's just so funny the fact that you've had all these experiences. Well, I love that you had all these experiences throughout Connecticut, and luckily I'm not at the point where I'm in a need where I feel like I need to talk to a pharmacist like individually, so I don't really have to ask any questions. I pick up prescriptions for my mom because that particular CVS is just like known for like long lines. Like they have a bad rep for like long lines and people being rude, and I totally get it. They're like burnt out and they probably get people being rude to them all day. So it's probably just coming back at us, right? So, but it's just, my mom just like, I just can't deal with them. Can you like go and pick up my medication? And so, I feel bad because it's like a two-way street where like that particular store is probably burnt out and have too much on their plate. And the people there, of course, their needs are important, but they're not, so we're not meeting people, I don't know, maybe halfway or something.
Yeah.
No, I completely understand and relate with that.
I know. But then the ones in the pharmacies inside the grocery stores, aren't they still CVS's?
So there are certain grocery stores, such as the Target locations, they have CVS's inside of them. But if you go to, for example, a Stop and Shop or a Big Y, those are,
I forgot about those,
those have not been, as of right now, they have not been bought out by a larger pharmacy-specific company. So,
this is random, and if you don't know the answer, that's fine. But do you know of any like, wouldn't it be cool if like a black family just opened like a pharmacy?
that would be amazing.
I was going to ask you that. I'm like, do you know
black
like
owned?
like a black owned pharmacy?
Yeah.
I don't know of any in Connecticut. No, I do not. But that would be amazing.
That would be awesome. Yeah.
If you know someone in business, tell them to reach out to me.
I know, right? Hire Sarah. Because I see a lot of people of color working at the pharmacy, which is cool because they're in Hartford and stuff, and I love that they're behind the counter. But I was thinking about that, like a standalone pharmacy or something like that, or maybe like a community health center, like a clinic that has like all these people of color working behind the counter.
Yeah,
that'd be like a nice world, right? And each of your specific fields or placements, what do you think is the biggest issue that you're seeing maybe currently? Because, things change. Like right now the flu stuff is going on, which I really want to talk about that. But other than the flu, what's one thing that you're seeing that is really affecting your patients?
I know specifically in my health center, the opioid epidemic is pretty huge, and it's just so big right now.
Yes.
We have a huge patient population who were on, chronic pain meds, and them getting upset when you try to either wean them off,
So
or
that's
just
the issue.
Yeah, it's huge right now, and addiction is huge. Pain management is huge. So that's a lot of
How
the
do you-
barriers we're seeing now.
How do you determine? Do you guys now have I was gonna say algorithm. Do you have a system now on how to determine how much medication you give to a patient for things that might be more addictive? Like, our providers have to communicate with the whole treatment team that person may have to figure out like have they filled up a prescription already for opioids or something like that?
Well, there's a system in place where you can actually look up a patient to see if they've gone to multiple providers, what were their recent prescriptions written. But specifically in my practice, we actually utilize a social worker.
Oh, nice.
She's amazing
yeah,
because
CSW.
yes. So there was an incident that took place prior to me even working there, where a certain physician no longer works there. However, there was a huge population where pain management was just kind of not being cared for, and patients were getting a multitude of prescriptions, and we're talking about different opioids and benzos, just like a cocktail that's dangerous for respiratory depression, cardiac arrest, just ugly, nasty things that comes with the side effects of these medications. But then you also just can't rip this away from people, because then that's when we get into street medications and heroin and
right, because if you don't prescribe,
methamphetamine.
they get it themselves.
Correct. So what we try to do is we try to, have a system in place where the social worker will refer them to pain management. We try to have our treatment plan in place where they're getting X-rays, MRIs, just to kind of prove the need for this pain medication.
Right.
And we send them to pain management, which is a specialty, and they are either on Suboxone, which is a medication to kind of help wean them off opioids, or some are in methadone clinics.
Are people, because I'm reading a book right now about a woman who she's like a mom and she works at home and stuff, and it's fiction, and I think she broke her ankle, and so her doctor kept prescribing her, what's the one that's really addictive for pain?
Girl,
codeine.
maybe it was something with codeine in it.
Sarah's
like, what was it? There's a ton. There's Percocet, there's Oxycodone.
Perks.
Okay, yeah.
So prescribed her Percocet for her pain, and I'm like, okay, that's regular. But then she became addicted. So she talks about in the book about how she found a way to get a prescription for Perks often from different people, and I'm just like, can you do that? Is it? And we're not encouraging anyone. We're not gonna tell you how to do that, but has it come to the point, are people able to do that even with all the technology and everything like that? Is there still a way for one individual to go to different doctors and farm and whatever and get Perks?
There's always loopholes in the system,
Yeah,
unfortunately.
find a way.
And then there's human error when it comes to our side as well.
That's
When
true.
you have patients who eagerly want these medications, but I try to approach them and say, well, what have we done that's non-pharmaceutical to help your pain before we just jump right into opioids? And some patients do need them, but unfortunately that is how classically it starts. It starts with the injury that leads to this addiction.
Are Perks the most common one?
It depends. So
Oh.
it depends
Yeah.
where you are again.
It's a multitude of pain
combination.
medications, and
Yeah.
mostly the scheduled drugs in general are.
Like I said, I pick up the prescriptions for my mom, and I'm always crazy because my mom has a really bad heart. So she has a pacemaker. We have a machine in the house, and so they're constantly prescribing her something. And she didn't have a tumor, but she had a baby tumor. Not a tumor. He looked at me like, oh my gosh, she has a tumor.
I know. I'm like,
No. Remember that time that her face was twitching?
Yes.
When she texted you? So we found out that she had a stroke.
Really?
Yes.
Does she have a TIA? It's a mini stroke.
Yeah, a mini stroke. Yep.
Yeah.
So she kept having that. So my mom texted Jakell, and her face was drooping, or her lip was quivering and stuff, and she kept having that. She went to Florida. I don't know what happened in Florida, but
I did advise her to report to the ER. I'm just throwing that out there.
Yes, she did. Yes, of course. I'm telling half the story, but she did advise her. She went on vacation to Florida, and I'm telling all this to get to a point. She went on to vacation to Florida. She lost her sense of smell, and all this weird stuff started happening. And then she ended up going to the doctor, and they told her oh, you've been having baby mini strokes, and you might get a stroke. So of course they prescribe her all this medication, and I'm just well, what the fuck? Like, you know what I mean? So I'm torn because I know, like, my mom is someone who's been, like, dependent on medication all the time. I know medication is supposed to help you, but there's, like, a lot of backlash about, like, medication. It's like you give somebody medication for their heart, but that medication makes them depressed. And then you get them the medication that, so they don't get depressed, but that doesn't allow them to sleep. So then you get them medication for their sleep, and then they stay awake. Like, it's just, like... So that's my little rant about how I'm conflicted about medication.
Yeah. And you get that a lot in our community specifically. There's
People
just
of color.
it's the fear and the distrust within the system, and that's because I feel like there's not enough of us to represent us.
Yes.
And that's where the disconnect comes in, because we automatically feel like sometimes there are provider bias, but sometimes there isn't, and there's just, you know, the notion that there is will just cause you to be like, whoa, I'm not doing this. And unfortunately, when we lapse in this treatment plan, that's when issues occur, and then we get mad and we're saying, well, why didn't you tell us this? But education happens, but the readiness to learn is not always there.
Also true. Girl just give me gems. So, Sarah, did you also have the same issue, the opioid, or did you have another issue that you found the most at?
Would you like me to have the same issue?
It's okay. I realized that I asked Jakell the question, and then we went on a whole different rant.
No, it always comes full circle.
Yeah,
absolutely.
No, because I know it's definitely related, but I was just gonna ask something really good, and I just left my brain.
Get it.
It was how do you guys handle people of color who are want to manage your pain in a holistic approach? So people who are ambivalent about medication, and they're like, well, can I drink it with tea? Like, you know, can I do this? Like, what if they don't want to take medication and they're asking you advice about what to do and how to manage it without medication? Is that rare? How do you handle that if it does come up?
So, first thing I want to touch on with that, I do definitely think that non-pharmacological treatment is sometimes even more important than pharmacological treatment. So, if you're talking about physical therapy, things like that, I am all for it. Let's talk about it. When you get into people who discuss herbals and supplements, I want to make it very clear. Those can be sometimes just as dangerous, if not more dangerous, than prescription medications.
Absolutely.
So when you talk about over-the-counter supplements and herbals, those for the most part are not regulated by the FDA.
They're not, yes.
All they need to prove is that they are safe enough to go on the counter. But some of these products have been tested, and what they say is in there is not even in there at all. So that's why it becomes important when you have a prescription medication. I know exactly what this medication is. I know exactly where it came from. I know if it's interacting with any of your other medications. If you're taking something over the counter that's not regulated, I don't know if it's interacting with anything else that you're taking. I don't know if it's dangerous for you specifically or just in general. So going back to what I was saying before, I am all for physical therapy. I'm all for things like that. But teas, herbal supplements, just say no.
Yeah.
I can't take a shot of ACV every morning.
Yeah.
I'm just kidding. Because that's what people say. They're like, I got a little cold. I'm going to take a little shot of apple cider vinegar.
And it's so funny that I feel like people will jump on that. Like if it says herbal, if it's all natural.
Yes.
But Sarah's like dead on with those same chemical properties being in a herbal remedy versus a medication, and people feel like they're being quote unquote more safe when they're just
more natural.
When they're, you know, like she said, like it's not regulated, so the amount you're taking, you know, it gets really tricky.
My mom she's the complete opposite of me. Like she's so she's into the herbs and all the holistic lifestyle. She has been having allergies for the past 2 years. She will not take my advice and take a Claritin. She will not do it. She will not. But she will take any and every other herbal supplement. And guess who still has allergies? My mom.
That is so crazy. So I am pretty stubborn when it comes to like having a headache. I'm like, no, I just need some water and some food. Like I'm not like one to pop a Tylenol like immediately, but I wouldn't neglect my body. Like I'm not gonna
Yeah.
You know,
And that's fine.
I get it.
That's
Yeah.
Because even I remember I told Jakell, I was like, oh, I'm taking these supplements. She was like, send me the prescription or
Yes,
send me
good.
like the picture of it because I want to make sure they're legit, which I still haven't done that. But I'm just like, I was thinking when I asked that question, I'm thinking about the Latinos, or I think it was when I got my MSW, we read a book about a family that was from Laos. I'm saying that right. And they went to a hospital. Their son had some kind of illness, and so the family was being really ambivalent and fighting with the people at the hospital, saying like, "No, we don't care what you recommend. We're taking him home." Is that considered medical neglect? I just thought about that question. So if you're recommending something for someone, and it's a child, and the parent is saying, "No, no, no, I don't care if Tommy has a blood clot." I made that up. But
I think when it comes to the pediatric population, because they are a vulnerable population in which they also need to be advocated for, I think that's a case-by-case situation. I know there was an incident in the Children's Hospital where parents, or I believe it was in Pennsylvania, the state escapes me, but a family wanted to decline medical treatment for a pediatric oncology patient. However, I don't think it was to the point where the patient was, in a far stage and close to death. I think it was something that could have been treated, but they still refused. I think that's kind of when advocates step in and, legal action starts to take place. But when it comes to pediatric population, that's always tricky. Or any population who's vulnerable, I should say, not specifically the pediatric, but it's always case by case. And then there's that, the ethics committee and...
Wow.
Yeah, there's just so many different players.
So many, yeah.
That's tough. Do you ever see that, Sarah, in your particular place? Like if somebody, well, no, because people are getting medication sent to the pharmacy, so they're picking it up willingly.
Yeah. So in my practice, I haven't seen too much of that particular case. No.
You touched on pediatrics. Let's talk about the flu epidemic, because if you look at the news, that is Oscar in the background. We are a pet-friendly podcast. He is very cute. If you look at the news right now, it's like kids are... Did you hear about that little boy that was in his hockey? That was so sad.
The 10-year-old.
So, I'm like the worst. I like watch the news, and then I don't get all the information. I think I know everything. So, is the issue that people are not getting vaccinated and then they're getting the flu, or is the issue that the flu vaccination is no longer enough for you not to get the flu? When I watch it as a consumer, I'm thinking like, oh my God, are people still not vaccinating their kids? Or is it, oh my God, the flu vaccine doesn't really help us from the flu? So that's where my mind goes. I'm like, is it that the flu vaccine is not enough, or is it that people are not vaccinating their kids? And I know, like, if somebody doesn't vaccinate their child, we wouldn't know that, right? Like, they wouldn't release that information. Like, Sarah didn't vaccinate her child, so her child infected everyone at the grammar school. Like,
because you can still get the flu even if you're vaccinated.
Right.
So this year specifically, the efficacy of the flu vaccine is only at 10 to 20%. As far as what it protects you from. When it comes to people getting the flu and actually dying from it, it's from their bodies being more susceptible to a bacterial infection. So when you get the flu, your body's at a vulnerable state. The flu is a viral infection. You become more susceptible to a bacterial infection. This, in most cases, that the flu causes death, it's caused from pneumonia that leads to septic shock that leads to death. Basically, your heart gives out.
So it might start with the flu, but then
So it's a cascade of events, and yes, the flu can be the primary culprit. Right. But the best way to protect yourself from the flu is still to get the flu vaccine. Yeah. However, that just brings us back to the community not trusting the healthcare. Yeah. And granted, I'm not saying the flu vaccine is perfect, but as far as a healthcare provider, do I educate for people to get it? Absolutely.
Definitely. And when you're talking about the vulnerable population, you're talking about the children in our community, you're talking about the elderly in our community, but on top of them being vaccinated, the best way to protect them is making sure you're vaccinated. So if you're going to be around them, then you also need to be vaccinated as well.
And both of your placements or your jobs, do they make you guys get vaccinated?
I am not forced to get vaccinated in my position, which I do think is interesting.
I am forced.
I'm forced too. So,
I did get the flu shot this year, and I do get it every year.
Yeah.
For my job, in particular, is a children's hospital, and
Okay.
Jakell knows this too because of the other hospital. But you have a badge that says like vaccinated, blah blah blah, and it's like and you get fired if you don't get your vaccination.
Yeah, there's
like a regulation.
There's a termination threat if you don't get the flu vaccine.
Right, and I get it because we're a children's hospital, but it's so interesting because I watch Law and Order SVU religiously, and there's a lot of episodes.
So
there's that episode where the mom, the kids all go to the kissing party.
Yes.
That's like one of my favorite episodes because it's like they all go to the kissing party, which of course it starts with something sexual and then it turns into something else.
Yeah.
And then all the kids got really sick, and it was because one mom didn't vaccinate her child and it affected everyone.
Yeah.
And it became a huge thing in like New York and stuff. So when I see stuff on TV, I always think of that. I'm like, oh my God, did somebody not vaccinate their child?
Yeah, you do get I specifically get a lot of backlash from parents who do not want to give their children immunizations, which is unfortunate because I just feel like the risk versus benefit, it's not worth it. Especially if your kid attends school or daycare, kids they're gross, they carry everything. So
they're so gross.
They spread quickly and they're little, their bodies can't take it.
Much more dangerous to get the flu than it is to get the flu shot.
Hello.
So
that might be the name of this episode. Tell me would you like to tell listeners about that flu clinic that you did?
Oh, sure. So one of my roles as a community pharmacist, we host flu clinics in the area. So one of our flu clinics happened to be held at a local church event. So it was a local church health fair. And when I got there with all my vaccines, with all my supplies, everything like that.
What town was it in?
This was in Enfield, Connecticut.
Okay.
And I got to the event and I had my technician with me, and I wasn't familiar with the church or anything like that, or I wasn't familiar with the church.
Yeah. So that was your first time there.
That was my first time there, and I get there and it is a black church. So pretty much everyone there, it's predominantly black. And when I go to set up, I'm there with my smiling face and my flyers, and I'm ready to immunize.
Ready to educate.
I'm so ready to talk about the benefits of the flu vaccine, and they were not having it. So,
who were you there with? Were you there with other pharmacists?
Nope, I was the only pharmacist there. I just had a technician there to help me out and to help me with the paperwork and everything. We probably gave, I think, like 6 flu shots that day. And this is a health clinic that had probably at least 100 people come through it, and we were expecting for so much more.
Wait, but it was the health clinic or the church?
It was a health. I apologize. It was a health fair being held in the church. It was sponsored by the church. It was open to the community, but it was mostly church members that were there.
So you were inside the church doing the flu clinic, and were people outside at the health fair?
So it was basically just one huge
event in the church.
Okay, exactly.
Sorry.
No.
So people would just breeze by, not even
breeze by. But I wouldn't let them breeze by. I would try to more than catch eye contact. I'm like, hey, would you be interested in your flu shot today? And pretty much every response was no, I don't get flu shots.
Yeah.
Not I don't want a flu shot today, or no thank you. No, I do not get flu shots.
I get
period.
the same thing. Yeah.
And were they older?
So no, it was all ages really. It was all ages, and it was pretty much when I would ask them, oh, why don't you get the flu shot? Why don't you do that? You don't know what's in that.
To the PharmD.
You don't know what's in it. But
You don't know what's in that. I don't put that stuff in my body. Why would I get a shot? I'm not sick. So it was responses like that. And I even had this one gentleman bring up to me the Tuskegee Project, and he
really
just took it. Yeah, he was ready. He was so ready. So I loved that Jakell was touching so much on, kind of the barrier between, especially people of color and people in white coats. So there is definitely a very real barrier, and I think it definitely does help to have people like me and Jakell, people of color, for them to come and talk to, but that resistance is still very much there, and it's very much ingrained in our community. And it's unfortunate, but to an extent, I understand why. I definitely understand why it's there. But it's unfortunate.
I think one thing that both you and Jakell have said that has resonated with me is that, multiple things, but the most common thread is that we need more people of color in the healthcare field. We need more representation. We need to build more trust within our community, right? So everything begins with trust. And I think that if patients, consumers, if we see more people that look like us in those fields, then we can trust, because you guys will know what approach you can use with people of color, because the approach is different. It comes from a cultural perspective. It comes from, figuring out what kind of needs they have if they have an immigration status, poverty, housing, transportation. It is not just a medical piece, and I think that all lies in. Could you guys speak a little bit about what is one thing, or if there's more than one thing, that's fine, that you would, what kind of advice would you give to a little girl of color who maybe wants to be a pharmacist or a nurse or wants to be in the medical field? What kind of advice would you give her?
I would always say just stand your ground, just stay grounded. It's going to be a lot of people who don't look like you, who don't know your culture, know what you're about, but to stay strong and keep pushing.
I like that.
Yeah. I would say don't give up, because there's definitely going to be times when you feel like giving up, and times when you feel like the work is too hard or too much, but it's not. You can do it. You can absolutely push through. Use whatever resources you have available to you, and definitely one thing that I wish someone would have told me earlier on is to definitely, something that I wish someone would have told me earlier on is to not have tunnel vision. Always look at all of your opportunities. Don't ever push anything out or shut anything out. At least give it a chance. At least do your research and see if, even though you might not think it was for you, see if it could be. So
yeah, and definitely self-care. You always talk about self-care. I was reading this article once, and it stated that Black women are the pillars to our community, so we'll take care of everybody else.
Yes,
everybody else except us.
Yep.
And I see that in my own mother. She puts everybody before her, and I always tell her to just kind of take care of yourself first. And I think she's taught me that, so I would just want to project that onto all women.
You know what I say? You can't pour from an empty cup.
You cannot pour from an empty
I like
cup.
that.
Yes.
I like that.
And I don't know where I learned that from, but it made so much sense.
Yeah.
I like that. That was my first time hearing that.
Yeah.
Really? Yeah, I like it.
I love it.
We're ending, so.
We are?
Yeah.
Wait, that's it?
Yeah.
How long have we been talking?
For an hour.
No, we didn't even get into STDs.
Do you want to talk about STDs?
Well, Plan B is over the counter.
It's over the counter.
And that's huge because, as a minor in Connecticut, reproductive rights is independent.
It is.
What do you mean reproductive rights?
So a child does not have to consult with their parent if they want birth control or if they want.
At what age? 13?
Yep, 14. We would
I
give.
thought it was just at Planned Parenthood.
No, when I was precepting in Bridgeport during my clinical in the high school, so that role is pretty special because the APRN there provided birth control to the high school kids, and they would pick up their prescription. We would have the prescriptions delivered to the high school, give the birth control pills to the girls, and their parents had no idea.
Who paid for the prescription? No.
You know what? That's a good question, because it wasn't through the insurance because the parents couldn't know.
Right. So that's why I thought that Planned Parenthood was the only person who could do
No,
that.
we were able to
because
do
they have
it.
funded.
Oh, but you know what? That specific clinic is under a federal grant when it comes to
I mean, not if
Donnie.
right, not if
Well,
Donnie's
Donnie is a little different. so.
right. I thought that girls could go to Planned Parenthood because it wouldn't be charged to their parents. But I'm like, at a primary care physician, I figured that the parents would know.
We were at the high school though, so it was a little
That's
different.
true. That's true.
So there was a
And they
grant in
couldn't-
place.
That's true.
Yeah.
So do you see a lot of people getting Plan B? Because I don't know anyone that's ever taken Plan B, and I'm not judging if anyone that I know has, but
No, yeah, so we definitely have people that come in and ask questions about it, which I'm more than happy to talk to people about. But you do see women and men coming in to purchase it. It is over the counter, available. You don't have to talk to the pharmacist to
And
get
you don't
it.
need
You
a
can just go
prescription.
ahead and don't need a prescription. Just go pick it up. And yeah, that is absolutely it. It's one pill. Do it.
how much? How much is it?
The Plan B brand name in the store I work in is $49.99. We do have a $10 coupon in the pharmacy, but you can also get the generic, which works just as well as the brand name, which is around, I believe, $35 to $39.
So to end, ladies, first I want to thank you so much because it's late and you guys both had a long week, and I really appreciate you supporting the podcast. Obviously, these are two experts in their field, and these are their experiences and their opinions. So I don't want you to take this as something that is the be all and end all. You know, do your research. Everyone has different experiences. And we obviously couldn't address everything on this episode. So, like I always say at the end of the episodes, please write me in my email, basiclatinapodcast@gmail.com. And maybe if you send me some questions that are medically related, I can have Jakell and Sarah come back and answer those questions for you. But like I always do on my guests, I'm going to ask you guys some rapid fire questions.
Ready?
I say rapid fire, but they're not. And if Jakell listens to it, maybe she. Well, you listen to past episodes, you probably know what questions I'm going to ask you. No. Oh, all right. So, what are you guys listening to right now?
In general,
Yeah.
well,
What's on the repeat?
I'm a sucker for Kanye Pandora radio station. So
Oh, really? I
yeah,
like that one. Okay.
I love
Kanye
his-
Pandora is really nice.
That's my favorite
It's
going to
very
work. Yeah, I like more of the old school stuff. I mean,
So you're bumping some Kanye and some old school.
love
old
SZA.
school- I love SZA.
Love
yes.
SZA.
Okay. What about you, Sarah?
I'm all about Drake radio. I love Drake.
Oh.
Love
Have you
it,
listened to his
love it.
new project? Like he has like 2 or 3 songs out now.
yeah, he does it.
So I'm pretty bad when it comes to music. So if it's not playing on the radio or my Pandora, I probably haven't heard it unless a friend or
I
my
get it.
boyfriend has introduced me. So yeah, I've heard one of his new. It's just one, right?
It's 2, I think.
It's 2 songs.
I've seen it on Tidal. That's the only reason I know.
Ah, okay.
I feel like once it gets warmer, it's like he resurfaces because he's gonna talk about like
Yeah.
something that's
He gets
gonna make y'all
summertime
lovey
pop.
dovey.
He gets whiny. I do love him.
Drinking and driving.
Drake and drive.
What are you guys reading right now? If there's anything that you're currently reading, and if you're not reading anything, what was the last thing you read?
I am currently in the middle of reading or listening, I should say, because it's on my Audible.
Oh, you're doing the Audible? How do you like Audible?
It's funny because one of my girlfriends, Lisette, do love her. She's also an
Hey, Lisette.
She's an APRN and she's a Latina.
Okay.
She put me onto her Audible, and I'm actually reading a book called The Couple Next Door, and it's actually
Why does that sound familiar?
it's a very it's a little sad. And it's about a couple's daughter who gets abducted. It's almost like a Law and Order episode in a book.
Ooh.
But I like to escape through books like this because I feel like my job is just so raw and so real life.
So you like to escape with a book about a girl being abducted?
Romance, or even like romance or like murder mysteries.
So how
something
is
fun.
it? Because I know you like to read those type of books. How is it listening to it for you?
It's great because I can listen to it and chart.
That's nice.
So it's almost like doing two things at the same time.
Is it the author doing it, or is it somebody else? Because I've heard mixed reviews about if an author reads the book as opposed to somebody else.
I'm not sure.
Okay.
This is my first time doing it. And they didn't say who was, doing the reading prior, but
Do you think you'll stick to audiobooks for a little bit?
I think so. My schedule's only getting busier.
Yeah. And at least you can listen to it in the car and stuff.
Yeah, or even when I'm prepping for classes and stuff like that.
That's awesome. When you're not listening to the podcast.
I always listen to the podcast.
Number one fan. What about you, Sarah Bear?
I'm currently reading a novel. It's
Oh my god.
I love her.
Is that an Oprah's book club sticker on
It sure is.
Get it, Sarah.
It is Backroads. That is the name of it, by Tawny Odell. I actually just started. I am on like chapter 2 maybe, but so far.
How is it?
So far so good. I like books about mystery and like suspense, and it's really setting the tone for all that. So I'm loving it so far.
I think we try to escape our...
No, totally. I'm reading A Wrinkle in Time because I can't wait until the movie comes out. I know The Wrinkle in Time is like a 6th grade book.
No, but it's a classic.
Yeah, no, I love those classics.
Yeah.
That's awesome.
Yeah.
I knew I wanted to watch the movie because I'm just excited for
I
it to
didn't
come
even know
out.
the movie was coming out.
Yeah.
When,
yes.
this year?
Yeah.
March. Ava DuVernay.
Oh,
You know Ava DuVernay?
Yeah, of course. I
Produced
didn't
it.
know.
Oprah's in it. Mindy Kaling. Reese
Yeah,
Witherspoon.
it's going to be
Stop
huge.
it.
Yeah.
Yeah, and the girl who's the main character is a little black girl with curly hair.
Yeah.
Oh, why haven't I heard
Shout
of
out to
this?
us again.
Right.
Yes, absolutely.
We in here. No, it's awesome. I love that. What are your morning routines like?
Oh.
On a good day.
On a good day,
Yeah.
I wake up. I love to watch the news. I've always watched the news.
That's amazing.
Because my grandmother always said, if you don't watch the news, you don't know what's going on.
Oh, okay,
And
Nana.
That's real.
And then being, growing up during like 9/11, I've always been like obsessed with what's going on. So
Right.
I watch the news, I shower, I walk my dog,
Oh, Marvy.
and I'm either running to Starbucks and running to the office.
Excuse me.
Did you mean like care stuff? Like what I use for
No.
skin? Oh, okay.
No, I was gonna say, is there any regimen of skincare that you have to do in the morning for yourself?
No. I mean, I always moisturize
Okay, I was gonna say, so your skin is just flawless.
every day. No, I do moisturize. I'm huge about that. I love the Body Shop, their body butter.
Oh, did you like it? The one you
Yes,
got?
so it's great for moisturizing because it actually penetrates the skin.
You said
My
it's
sister
great.
taught me that.
Grapefruit.
No. I think I'm using the cocoa
Oh no, what
flavor.
did you say before that? It penetrates your skin because it's what?
Because of the thickness.
Oh, it's okay. So Body Shop, it's cocoa, the cocoa one.
Yes.
Cocoa butter one. No,
And I
that's
do
good.
use rose water on my face.
Oh, look at that! See, that's what I was
Ooh.
looking for.
Yeah.
But you don't use the Body Shop moisturizer on your face, do you? Or do you?
No, I actually use vitamin C on my face. Vitamin C oil.
Oh, okay. So
I guess I
vitamin
do have a regimen.
Yeah, I was gonna say, don't you do? You totally do. I'm like,
Sometimes I do the most. So
so I know you do vitamin C for the morning, and that's oil, and
Yeah.
then rose water over the oil.
I do the rose water first to kind of like set it as a,
Do you use the
moisturizer.
Mario Badescu rose water?
To be honest, it was something I brought out of Marshall's for $6, and it works fabulous.
No, that's fine.
Yeah, I'm not really sure of the brand.
No, it's okay. Mario Badescu is this brand in Ulta. It's like mad expensive.
You usually keep me up to date with the
I'll send you the link.
skincare stuff.
What about you, Sarah? What's your morning routine like?
Every morning I roll out of bed and I get Oscar out of his bed. You may hear Oscar walking around right now. And I take him for a quick walk. I feed him. I get myself ready, shower, iron my clothes, and usually I'll be packing my lunch in the morning, if not the night before, and then I'm
You guys are
gone for
both
the
really good
day.
about that.
Yeah, definitely. I always pack a breakfast. I don't usually eat at home, but it is important for me to eat like as soon as I get to work.
Yeah.
Do you both eat when you get to work? No, you say you eat when you're at home.
I eat breakfast before I leave the house, and then I'll grab a tea on the way to work.
Okay, and you eat breakfast at?
I'll bring cereal usually, or fruit or something, and I'll bring it to work, and I'll eat it while I'm
Breakfast
getting
is
ready.
really important for sure.
Definitely.
And do you use anything for your skin? Because your skin is beautiful.
I don't have anything
Her skin is
fancy.
flawless.
I'm sorry.
You say you just wash with water
It's
would be bad.
I don't. I use right now. I'm using, and it's gonna sound super bougie, but it's not. I promise. I'm using Borghese. That's the cleanser I'm using.
Oh yeah, I'm a Borghese. Yeah.
I love Borghese. So I'm using their cleanser. But really, besides that, I don't have anything special going
Ridiculous.
on. I'm sorry.
And hers can be popping all year round.
All the time. Gorgeous.
What are your night routines like? So you have a really stressful job. You're trying to turn down for the night. You might not do anything special. You might just go the fuck to sleep. Like I have to do the most because I haven't done it yet.
Yeah.
But what do you do to go to bed?
My guilty pleasure is I love my Ratchet TV. Like I have to come home and watch my shows.
Nice.
I definitely do. So all my reality shows, I love it. I have to.
Do you go to sleep with the TV on?
I don't. That's one thing. You're gonna think this is so creepy, but I can't sleep with any noise at all.
Oh, me
and
neither.
every night I sleep with earplugs in.
Stop it.
And,
Wait a minute.
and an eye mask every night.
Oh, you know what? My sister goes to sleep with an eye mask, and she's like, "That's the best thing."
The best. It's the most amazing
I
thing you
sleep
can
so
do.
aggressive, it will come the fuck up.
She does.
Maybe I'll try to learn Vegas.
No.
So, oh wow, so an eye mask, do you use like a special one, like a silk one?
No, I just bought
lavender?
one. No, I just bought like a cheap one off of Amazon.
And then earplugs. Ooh, aren't you ever scared that it's gonna stay in your ear?
No, because it has a string attached to it, and I just pull the string.
Oh, it's not like those ones that are like free.
No,
like,
I can give
hanging?
you samples. I have like a huge box of them.
Oh, that's awesome.
That'd be awesome. Do you do anything to your face or your hair to prep for the evening?
On a good night, I will twist my hair before I go to bed, preferably a flat twist. Tonight, I probably won't. I will probably just put my bonnet on and go to bed.
So I was gonna say, do you prefer a bonnet or a silk pillowcase?
Bonnet, definitely.
Excuse me. What about you, Jakell? What is your night routine like? And I've seen your night routine, so.
It depends on the night. I like to watch TV as well before bed. Mm-hmm. To be honest, it doesn't matter. Like, I'll watch the news again before I go to bed. Or I'll watch something like, My 600-Pound Life or something, just weird. Or
1 Ton Family.
Yeah, I like weird TV shows. But I can either fall asleep with or without the TV on.
Mm-hmm. You fall asleep literally anywhere.
Yeah, I can sleep anywhere.
And I know you do your pañuelo and your oil and stuff.
Yeah, so I'll either kind of like put coconut oil in my hair and put a silk scarf on.
Sorry, pañuelo means scarf.
Yeah. And I just fall asleep.
Nice. And do you cleanse your skin with anything?
Yeah, I'll try to do a scrub before bed.
Oh, nice.
I'm using that blueberry acai scrub from Trader Joe's.
Did you like it?
I do. I use it twice a week.
Because that's the one we bought together.
Yeah.
Yeah, that's awesome.
So that's what I've been using.
That's awesome. Perfect. And what has made you guys the happiest this week?
What made me the happiest this week?
We have pretty bleak weeks, they're long, they might be tiring. So what was a light? And it could have been anything. It could have been that somebody brought you a fruit roll-up, or, you got, I don't know, but a really disgruntled patient, I don't know, that was nice to you or something. So what was something that was like, oh, that was nice?
For me this week, it was probably when I saw a 3-year-old patient for a regular physical, and she was eating hash browns the whole time, and she wanted to share with me. And when we were done with her physical, she literally ran around the office crying for me. She did not want to leave with her mom.
Oh,
so
that's cute.
They came and got me, and I was, able to give her a hug and told her she'll be back in a year. And she was like, not. She was upset about that. But that was so cute.
That was really cute.
Yeah.
That's
like that.
super sweet.
Yeah.
The light of my week. I would have to say. The light of my...
Sarah, it's really hard for you to find the light of your week, girl.
No,
She's tired.
there's just so many lights. You know?
There you go. She's like, well, you have
Just pick one.
the lights on lights on lights.
So I would have to say the light of my week would be today, actually, because it was my last day working as the part-time pharmacist in Enfield before I start my new position as pharmacy manager in Holyoke. So when I walked into Enfield today, my technicians had brought me flowers and balloons and cards, and it was just nice to see that I had impacted the pharmacy and they've impacted me, and I'm just gonna love and miss them.
Did you cry?
No.
Oh,
That's
Sarah's
so
a crier.
sweet.
I am a crier, but I did not cry today.
I was gonna cry just now. Like,
We have a dinner planned, so
that's
maybe I'll cry
fine.
at the dinner.
Yeah, definitely.
that's very sweet, and your flowers are beautiful.
Thanks.
And one last question, the biggest question of all:
Ooh.
what do you do for self-care?
I was about to
I
say something so inappropriate.
get a manicure every 2 weeks if it's the last thing I do.
I know that's something I know.
I'm big on that.
Yeah, that's good.
I need to kind of like escape.
Not a pedicure, just a manicure.
So in the winter, I'll get one maybe like once a month.
Ooh, that's good.
But Mike is pretty good about encouraging me to just kind of do that for myself.
Oh, I love that.
Nice,
That's
nice. Self.
You can totally be inappropriate. Because you were like, I was gonna say something inappropriate. I'm like, you could be inappropriate.
No. So for self-care, I used to actually be big on manicures. I haven't gotten a manicure in a very long time, so maybe I should.
You
get a
deserve that.
manicure. I do deserve it. For self-care, can't think of anything.
Yeah.
There's. I just haven't have to be anything complex. It could be reading.
I know.
Girl, put them on your
think.
earplugs and your eye mask is
Yeah.
self care. Like anything could be self care.
Okay.
Having dinner with your mom.
Okay. I'm ready. Okay. So.
She's ready, Gabbie.
So once a week for self-care, and this is going to sound weird, but I love deep conditioning my hair.
That is not weird. I love deep conditioning hair.
It's just nice to sit under the dryer with a book or with just, I don't know, something to read.
That's great.
Yeah.
I love that.
No, that's amazing. I was just telling my coworker that I miss reading books during the day. Mm-hmm. Like I used to at least, I don't know why I stopped, but on the weekend or during the week, I used to always take myself out to lunch and read a book. Like, you know, even today I was reading a book today before I was waiting for our like dinner and stuff like that. So I feel like I'm so busy, I don't get home until so late. I try to like curl in bed with a book and then I fall asleep. And then I can never finish the book. So I like miss the days where I'm like, oh, it's still light out and I'm reading and I can enjoy it. But that's awesome. Again, thank you ladies so much for being on the podcast. I'm so excited for people to listen to this because I think they'll get a lot from it, and I hope people will write in and you guys will come back and visit.
Thank you for having us.
Thank you.
Of course, and putting up with it, and thank you guys so much for putting up with Oscar. He is really cute, so you would forgive him if you saw his face. Thank you guys so much for listening to tonight's episode. It was a late one, and I really appreciate the ladies for putting up with all the rescheduling and everything to get this to happen. If you like the episode, make sure that you rate, review, and subscribe. We are on iTunes or Apple Podcasts, I should say, SoundCloud, and YouTube. If you rate, review, and subscribe, it allows other people to see the podcast. And as we know, visibility is essential in order to highlight the people of color on this podcast. And like I mentioned before, if you have any comments, questions, or suggestions for the podcast, you can email me at basiclatinapodcast@gmail.com. We intend to do a listener letter episode later in the season, or if you want to send a letter to a particular guest, we'll answer them on the show. I would like to thank the Pod Squad for making Basic Latina Podcast sound so good. The sound editing is by Gabbie Barnes, and the music is by Michael Guns. I'll talk to you guys soon. Stay well and take care.